Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Prolactin secretion, and you're looking at what are the factors which affect this. So first let's look at what will increase the prolactin secretion. So the increase in prolactin secretion is by sleep. So sleep, it increases the prolactin secretion, as well as stress, it increases the prolactin secretion. Then in case of the strenuous exercise, so strenuous exercise, then sexual intercourse with women, then in case of pregnancy, in terms of the pregnancy, then in terms of nursing, the breast stimulation in non-lactating women, the breast stimulation in terms of non-lactating women, then as well as in estrogen, the hypothyroidism, in terms of the TRH, opioids, in terms of the TRH, next in terms of the opioids, as well as the phenothiazines and the butyrophenones, the phenothiazines as well as the butyrophenones. Next is the atypical antipsychotics. The atypical antipsychotics such as the risperidone, all this will increase the prolactin secretion. So atypical antipsychotics like that, the risperidone. Next is the dopamine synthesis inhibitors. Dopamine synthesis inhibitors such as the alpha methyl dopa, that is alpha MD. Next is what increases are the H2 antagonist, that is the cimetidine and the ranitidine. Then comes the imipramines. So what are the imipramines? We have seen it in the other video as well. So imipramine, it includes the amitriptyline, amoxapine. So it is the amitriptyline as well as the amoxapine. Then there is this SRI, that is the serotonin reuptake inhibitors. This includes the fluoxetine. Next is the calcium channel blockers. So calcium channel blockers includes the verapamil, and then there is also the thioxanthines as well as the metoclopramide. Next is there is the catecholamine depleters. So there is a catecholamine depleters. So catecholamine depleters is includes the reserpine. Now this was all about the increase in prolactin secretion. Now let's look at what decreases the prolactin secretion. So the decrease is caused by there is dopamine and there is L-dopa. Next is the apomorphine, as well as there is a bromocriptine and related ergot derivatives. There is a bromocriptine as well as the related ergot derivatives. To learn and grow daily like this, please do subscribe.